So, very good evening and a warm welcome to all of you who have joined for this live session. Organized by Endocrine Society of India. And the session is for spreading more and more awareness about diabetes. I think we all know that November is basically the diabetes awareness month. And 14th November, we are very close to 14th November, is when we celebrate the World Diabetes Day. So, what better day we could have to discuss more and more about diabetes? सो आज हम सब यहाँ पे इसीलिए इकट्ठा हैं कि हम डायबिटीज़ के बारे में कि डायबिटीज़ के पेशेंट्स को और उनके घर वालों को कि सबको पता होना चाहिए कि डायबिटीज़ के लिए हमें क्या-क्या टेस्ट करना चाहिए, कैसे अपना मेडिसिन्स का ध्यान रखना चाहिए, किस तरह से डायबिटीज के कॉम्प्लिकेशंस होते हैं, किस तरह से वो बॉडी के सब ऑर्गन्स को अफेक्ट करते हैं. सो टू नो मोर अबाउट ऑल दिस, we are here today on the live session by Endocrine Society of India, and I'm Dr. Aditi Chopra. I'm a consultant endocrinologist at Bangalore, and it's my privilege to have four panelists amongst us. So it's my warm welcome to our first panelist. So it is Dr. Usha Ayagri, and ma'am is a senior consultant in diabetes and endocrinology and general medicine at Apollo Sugar Clinics in Chennai. A very warm welcome to you, madam.
Good afternoon, and thank you very much for the very kind introduction, Dr. Aditi.
Yes, so coming to our next panelist, we have Dr. Felix Jebasing amongst us. Sir is a professor in the Department of Endocrinology at CMC Vellore. Very warm welcome to you, sir.
Yeah, thank you, Aditi, for the introduction, and good afternoon, everyone.
I would like to welcome Dr. Annie Pulikal. She is a consultant endocrinologist at Medical Trust Hospital, Kochi. Good evening, madam. Welcome.
Thank you, Aditi, for that.
And I would like to welcome Dr. Pratibha Paval, ma'am. She's a consultant endocrinologist and assistant professor at MGM Medical College, Aurangabad. Welcome to you, madam.
Good afternoon, everybody. Thank you.
Yeah, thank you to our esteemed panelists and all those who have joined for this live session. So, as I mentioned, we'll be discussing more about diabetes and how everybody should be aware that what is diabetes and what are the common tests and what are the symptoms and what are the complications. So, just इसी के बारे में और बात करने के लिए आज हम सब यहाँ हैं. So, I think we'll begin with Dr. Usha, madam. Madam, can you just tell us that what are the common types of diabetes that we have? Like we hear about different types of diabetes. So if you could tell us, and what is the difference between we hear type 1, type 2. So if you could tell our viewers what are the types and what is the difference between these two common types of diabetes?
So thank you very much for that question, Dr. Aditi. Now, you're right. We do hear about different types of diabetes, and it's really important to understand the fundamental difference between these. When people talk about diabetes, in general, what they mean is type 2 diabetes, which is the most common form of diabetes that we see. But actually, if you think in terms of diabetes, we have diabetes that requires insulin lifelong, which is type 1 diabetes, which usually occurs in younger individuals. Now, if you think of diabetes, you have an organ called the pancreas sitting just behind your belly button. This secretes a hormone called insulin. People know about this. In type 1 diabetes, what ends up happening is that there is an absolute deficiency of insulin. People don't have any insulin at all, and therefore they need insulin from some source or the other to be given from outside. There are some myths circulating, and I'm sure we'll come to that, about bringing people off of insulin. Let's please say right off the bat, this does not apply to type 1 diabetes. Now, in type 2 diabetes, your pancreas may still be secreting some insulin, but it's not enough for your body to use effectively. And the cells don't use the insulin as effectively as they could. And there are various strategies that we use both to maybe boost the insulin secretion, but also to perhaps help our body use the insulin that we have more effectively. Then the other type of diabetes we hear about is the kind of diabetes that women get in pregnancy. When your high sugars are detected for the first time in pregnancy, we call it gestational diabetes. This kind of diabetes requires attention and care because it can change the course of pregnancy and the outcomes for both the mother and the baby. And then there is a whole other category, and we just lump a lot of other things under this other category. That could be diabetes due to genetic causes, that could be diabetes because of diseases that affect the pancreas, that could be diabetes because of other associated diseases such as pancreatitis or cystic fibrosis. You can have diabetes after, say, for example, somebody is on steroids and that can elevate their blood glucose levels. So, broadly speaking, type 1, type 2, gestational, and a whole category of others that we lump together into a miscellaneous category.
राइट, थैंक यू सो मच मैम फॉर दैट एक्सप्लेनेशन. सो जो सब हमारे साथ हैं उनको बस यही बताने के लिए कि यही टाइप 1 और टाइप 2 ये दो डायबिटीज हम कॉमन सुनते हैं. तो इसमें से टाइप 2 वाली ज्यादा कॉमन है जैसे कि मैम ने बताया, और टाइप 1 जिसमें इंसुलिन नहीं प्रोड्यूस होता और यूजुअली टाइप 1 वालों को इंसुलिन पे डिपेंडेंट रहना पड़ता है. तो उसके अलावा तीसरा टाइप ऑफ डायबिटीज वो जो गर्भवती औरतों में देखी जाती है, जेस्टेशनल डायबिटीज. एंड उसके अलावा और काफी सारे कारण होते हैं. कुछ स्टीरॉइड्स अगर आप ले रहे हैं, नहीं तो आपके पैनक्रियाज में अगर कुछ प्रॉब्लम है, तो काफी कारण होते हैं डायबिटीज के. बट हाँ, दो कॉमन जो है हमारे टाइप 1 और टाइप 2, और जो सबसे कॉमन जो हम देखते हैं वो टाइप 2 डायबिटीज है. So coming to the next question, it's for Dr. Felix. Sir, can you tell that actually who are the patients who are at risk for getting type 2 diabetes so that they are more cautious, and who all should be screened for type 2 diabetes, and what are the common symptoms because of diabetes that people can experience? So if you could tell us that, sir.
Yeah, thank you, Aditi, for the question. And we all know that type 2 is diabetes is the commonest type of diabetes across the globe. And as an Asian Indian and an Indian origin, we are actually at risk for type 2 diabetes because of multiple reasons. And one of the important reason is that of late we have industrialization and we have the availability of the food and the reduction in the physical activity, etc. And more so in recent times, we were in the lockdown period where we were staying inside the house. However, we are not improved our physical activity. And more so, if we go across the road and we find that maybe 10 year 20 years before the people were thin and probably in the overweight condition, where now actually become obese. So by and large it is actually in community, and it is that obesity which is really a major factor, and it actually runs parallel with the prevalence of diabetes across India. And more so in certain metropolitan cities, we can see that even the prevalence has gone even up to 1/4 of the population being diagnosed with diabetes, and other 1/4 have a pre-diabetes stage. That means they are knocking at the doors of being getting into a being diabetic in the next years to come. And the more worrying is actually the young individuals and the teenagers getting obese, and they are having the risk of getting diabetes in the future. And thirdly, the pregnant women who has gestational diabetes as actually, or probably in other words, they had a high risk of diabetes in future. It's like a teaser of a movie where the women has gestational related diabetes, GDM we call it, and further they become diabetes up to 50% over the next 5 to 10 years of their last pregnancy. So more so, it is important to understand that as a Indian, we know that we have everything in our steps. Uh, Say that foods, groceries, and the communication we do is it's in our hands, and we don't go to the next doors to knock and speak to our neighbors. We don't go to the nearby shop even if it's 100 meters. We call them up and get our food packages packed and delivered at our footsteps, and most of the groceries also. So our physical activity has come down to a greater extent, and but our calories are not being reduced. But even though we can see that the calorie intake has gone higher, which is disproportionate and discordant than that of the physical activity. So by and large, we actually are at risk for diabetes because of the ethnicity, and secondly, our cultural activities have been changed from an active lifestyle pattern probably 5 decades before to an sedentary lifestyle pattern. So that is why we are at high risk. And secondly, if we look at the symptoms, it actually can be a asymptomatic phase. That means we may not have any symptoms of at hyperglycemia, which is called high sugars, to probably having a major detrimental symptoms of high sugars with what we call hyperosmolar symptoms, where they been highly symptomatic. But the traditional symptoms are increased urination because of a lot of glucose passing in the urine, and because of that can get more increased thirst, increased weight loss because of the catabolic state. And also we need to remember that we may end up eating more and more food because of our catabolic state. Secondly, we also see that many people in the current era, when they have burning sensation of the feet, they go and check their sugars. That also is a symptom of high sugars, and numbness of the hands. And if the patient does not have any symptoms, certain features like what we call as acanthosis nigricans, where there is an increased pigmentation in the neck or an armpit or in the skin folds, which is actually indicate that there we might be having an insulin resistant, which that means the insulin is not acting as much it can be, so that we are at high risk for diabetes. So and if there is very high sugars for longer duration, there might be a poor wound healing, recurrent ulcers, and recurrent fungal infections, especially in the genital region, which is very very common in Indian scenario because of the tropical weather and etc. So by and large, type 2 diabetes is very common, and it can be asymptomatic to symptomatic.
Right. थैंक यू सो मच सर फॉर एक्सप्लेनिंग इट सो वेल. तो बस यही मैं सब अपने दर्शकों को बताना चाहूंगी कि ज़रूरी नहीं है कि सब डायबिटीज़ के पेशेंट्स को कुछ लक्षण हो. तो जिनको रिस्क है डायबिटीज़ होने का, जैसे कि अगर किसी के फैमिली में किसी को डायबिटीज़ है और अगर वेट ज़्यादा है, मोटापा है, लाइफस्टाइल सेडेंटरी है, तो उनको अपना शुगर ज़रूर चेक कराना चाहिए ताकि हम उसको अर्ली ही डिटेक्ट कर पाएँ. So next question is for Dr. Annie. Madam, how do we actually diagnose diabetes, and what are the cutoffs that we use, to say that somebody has diabetes, and what is pre-diabetes? Like, when do we say that somebody has diabetes or somebody has pre-diabetes? Ma'am, if you could tell us that.
Thank you, Aditi. So it is very easy to diagnose diabetes. The difficulty is in management. So to diagnose, you can just do a blood test. You can check a fasting plasma glucose level, a random blood glucose level, or a postprandial blood glucose level. A fasting blood glucose level above 126, you can call it diabetic, or a postprandial or a random blood glucose level above 200, you call it a diabetic. And we also have HbA1c, or glycated hemoglobin, which gives you the 3 months average of your blood glucose level. A level more than 6.5 is suggestive of diabetes. So, pre-diabetes is nothing but a condition where your sugars are higher than usual, but not as high as to call it diabetic. So, for pre-diabetes, the cutoff is if your fasting glucose levels are between 100 to 126, your postprandial or your random is between 140 to 200, or your HbA1c is between 5.7 to 6.5. So it's important to diagnose them early, that is, to diagnose in the pre diabetic stage, because if you diagnose them in that early stage, it by diet and lifestyle modification, it is actually possible to reverse them and bring them back, bring their blood glucose levels to normal. So,
या
thank
थैंक यू
you.
सो मच मैम, थैंक यू। सो वही जो मैम ने बताया कि डायग्नोज करना डायबिटीज तो बहुत आसान है। आप अपने ब्लड से चेक कर सकते हैं, या तो खाली पेट का शुगर चेक कर सकते हैं, नहीं तो एक टेस्ट होता है HbA1c जो आपके 3 मंथ्स का औसत बताता है शुगर का। बट इम्पॉर्टेंट है ये चीज़ जानना कि प्री डायबिटीज डायबिटीज होने से पहले कुछ लोगों में प्री डायबिटीज होता है, और अगर आप इसी स्टेज पे अगर अपना लाइफस्टाइल चेंज करते हैं तो ऐसा पॉसिबिलिटी है कि आपका डायबिटीज प्री डायबिटीज नॉर्मल पे भी आ सकता है। तो जिनको भी प्री डायबिटीज है तो प्लीज वो अपना लाइफस्टाइल का ध्यान रखें ताकि डायबिटीज प्रोग्रेस होने से हम रोक सकें। So I think moving on to the next question, it's for Dr. Pratibha ma'am. Ma'am, so what are the ways in which, as ma'am told, diagnosis is very simple, but it's the treatment which is challenging. So how do we actually, treat diabetes? What are the ways? There are tablets and there are insulin. There are a lot of misconception myths. Which is better? When do we choose tablets for some? When do we choose insulin, ma'am? If you could throw some light on treatment of diabetes.
That's $1 million question, Aditi, because we know that the diabetes is becoming very common. Many people are getting diagnosed with diabetes. They know what is diabetes, and my blood sugars level are high. But moment we utter the treatment, most of them of the opinion that please tell me the diet, please tell me the exercise, but I do not want the tablets because the tablets will damage my kidneys. It will affect my body organs. So the first thing, definitely the lifestyle works in all forms of diabetes, may it be gestational, may it be type 1 or type 2. It is the regular diet, low carbohydrate, high protein diet, small frequent meals, that is the dietary precautions. The next thing is regular exercise, which helps in the blood sugar control. The stress reduction is the important factor, as well as the adequate sleep. But all these lifestyle factors work for initially in diabetes control, but as time progresses, there is gradual reduction in the insulin production capacity of the pancreas, and that is the time we need to start them on tablets. The definitely I would like to say here, the why we are giving these tablets, it is the high blood glucose level which damages the body organs, and by giving the tablets we are actually reducing the blood glucose level and helping not to affect these body organs. Actually, the tablets and insulin are your friends, which will protect your body from the bad blood glucose level. So when we consider tablets, the initially in previous more than 30, 40 years, we used to use the sulfonylureas and metformin. These are the drugs. The sulfonylureas are definitely good in today's era also in the glucose control, but it had some side effects like low blood glucose level and weight gain. And that will happen only when we do not check the glucose appropriately, do not take the diet on time. But in recent era, there are newer tablets available like gliptins and SGLT2 inhibitors. These are the drugs which will help you not only the blood glucose control, but definitely these medications will help you to protect yourself from the cardiac disease as well as the renal disease. So definitely these tablets are given to the patients only after testing these tablets in the lakhs of people, monitored the people over the years, and once the safety data is proven, then only these tablets are prescribed to the patient. So don't aware of taking medications. It is not for the punishment, but because it's a natural history of the disease, the gradual insulin reduction, and that's why after lifestyle we need to start on the tablets. This is in type 2 diabetes. After 5 to 8 years of diabetes, the tablets do not work and we need to start them on insulin. It is not for the punishment, it is not the failure on the patient's part, but it is the natural history of the disease which makes us to prescribe the insulin. And the insulin is the best drug which causes the maximum reduction in the blood glucose level and gives the protection against the complications of diabetes. So, but only when we need to start early. Initially, insulin used to be used as a last resort in diabetes management. But as the research now says that if you use the insulin early, that can protect you from the complications of diabetes. As Usha madam has told, this insulin is start later in type 2 diabetes, but in type 1 diabetes, insulin is the only and main treatment in type 1 diabetes apart from lifestyle. Similarly, in gestational diabetes, insulin is the safe drug for both baby as well as mother. Initially, insulin used to be in the form of vial and syringe, But now the very painless form, it is available in the form of insulin pen with very small size needle. But you will not get away from that fever unless you prick yourself once. So before refusing insulin, please just try to take insulin once with the pain, and you feel that no, it is absolutely painless. So these are the treatment options available for the diabetes, and we should not refuse for the treatment because of the myths. We need to get our myths cleared from our the treating doctor. That is my request.
थैंक यू सो मच मैम फॉर एक्सप्लेनिंग इट इन सो मच डिटेल। तो जैसे कि डॉक्टर प्रतिभा ने बताया कि टैबलेट्स और इंसुलिन डायबिटीज के पेशेंट्स के दोस्त हैं, वो आपका किडनी पे या किसी और ऑर्गन पे इफेक्ट नहीं करेंगे, वो सेफ है, वही है जो आपका शुगर कंट्रोल करता है और आपके किडनीज को खराब होने से बचाता है। सो अगर आपके डॉक्टर कहते हैं कि आपको टैबलेट्स या इंसुलिन की ज़रूरत है, तो प्लीज़ उससे डरिए नहीं, वही आपके दोस्त हैं डायबिटीज़ को मैनेज करने के लिए। So now coming to the next question, I think Usha madam. So how do we say that somebody is well controlled? So what are the targets that we are trying to achieve for control of diabetes? And is it same for all? Like if somebody is old, so are the targets little different? Is it that different age groups we have a different target for sugar control, ma'am? So if you can tell that, ma'am.
So that's a very good question, Aditi. And I think the second part of the question is by far the more important. We all know that with diabetes, and I'm sure we'll be discussing it, good control allows a longer period of healthy life, and that good control reduces complications. But what do we mean by good control? That changes depending on the person sitting in front of you. Let's say we were talking about gestation diabetes, diabetes in pregnancy earlier. The control, the range is much tighter, much narrower, and the control is much, much, much tighter than outside of pregnancy to keep the mom and baby safe. Let's say we're talking about somebody elderly, and I'm specifically not quoting any numbers here because the point of control is that it needs to be individualized. That's the keyword, individualized to the person living with diabetes. And individualization takes into account multiple factors. So let's say, for example, there is somebody who's elderly, 70. The target for them might be different. But let's say there is somebody who's 65 but has heart problems or liver problems or kidney problems. It's not just age that we take into consideration. I might want the person who's 70 but healthy aiming for a tighter target than somebody, say, who's 60 but has multiple other problems. So, what is defined as good control? We know optimally, if we want to keep somebody complication free, for example, early on in diabetes, we'd like to keep the A1C at or below 6.5. But the longer, and I'm talking about both type 1 and type 2, but the longer you live with diabetes, there are a few caveats. Get to the tightest control you can with the minimum risk of hypoglycemia and other complications. But more importantly, we need to individualize, set the target to what is suitable for you. Now, if you're 70 but healthy, I might still aim to get you to a good control. On the other hand, if you're 60 but you have heart disease, liver disease, kidney problems, we might set a slightly more relaxed target. In terms of targets, it's not just the HbA1c. We would want to look at the target for a fasting glucose, for a pre-meal glucose, for a post-meal glucose, and throughout the day, overnight as well. What would consider a good A1C? Actually, as you age, yes, you're right, that's one of the criteria. You can aim for a slightly higher A1C without any detrimental effect. But remember that in India, majority of our individuals with diabetes, as Dr. Felix said earlier, are being diagnosed at a younger and younger age. So certainly for those who are young and living without complications, the name of the game is really tighten that control as long as you can do it safely without having any hypoglycemia and other adverse events, and get them down to less than 6.5 if you can in terms of HbA1c. But at all other stages of life, you need to have that discussion with your doctor as to, given my condition, given my complications, what is a safe A1C for me to achieve.
राइट, थैंक यू सो मच मैम। सो दैट, जैसे कि मैम ने समझाया कि केवल एज के हिसाब से नहीं, बहुत सारी चीज़ें आपके डॉक्टर कंसिडर करते हैं देखने के लिए कि कब आप कहेंगे कि आपका ग्लूकोज अच्छे से कंट्रोल्ड है कि नहीं। अगर आपके किडनी में, लिवर में, हार्ट में कुछ प्रॉब्लम्स है तो आपका ग्लूकोज कंट्रोल अलग होता है। अगर कोई गर्भवती औरत है तो उनके लिए जो अच्छा ग्लूकोज कंट्रोल है वो अलग होता है। तो हर हर मरीज जिनको डायबिटीज है, एवरीबडी इज डिफरेंट, सबका ग्लूकोज कंट्रोल का टारगेट अलग होता है। इसीलिए सबको रेगुलरली अपना चेकअप करवा के अपने डॉक्टर से संपर्क में रखना चाहिए, ताकि हम डायबिटीज की कॉम्प्लिकेशंस को प्रिवेंट कर सकें। So, जैसे कि we were just discussing, I think for Dr. Felix, I would ask him that ma'am just was talking about diabetes in pregnant women, sir. So that is what we hear about. One more type of diabetes, gestational diabetes. So, if you could tell us that what is this gestational diabetes and how do we diagnose it, and what are the cutoffs for gestational diabetes, and what are the ways we treat gestational diabetes, sir?
Yeah, thank you, Aditi. And that's a very, very important question to be discussed in public, because of the lot of misconception, and also lot of public messages goes across the different group of people, especially reproductive women. We know that diabetes is goes long BMI, and we know that the average BMI of an urban and the rural women are in the increasing trend. And what is GDM is, in simple language, is a diabetes which happens during pregnancy. It's known that pregnant women has placenta, which is the like a source for nutrition to the baby, so that it acts in such a way that there are a lot of nutrients being pumped from the mother to the baby. And also certain hormones are being produced in the placenta, which is actually connecting the mother and the baby, actually is important for the growth. But definitely when there is a placenta which actually causes some spillover of hormones, which is supposed to be for the growth of the baby, into the mother. And if the mother has already a state of obesity or family history of diabetes, and definitely in Indian origin, and other, suppose they have a genetic mediated diabetes, as Dr. Usha has told initially in the past, what will going to happen is they are actually predisposed to get a diabetes during pregnancy. So this is a diabetes they get during pregnancy, and that you generally can might be diagnosed even the first trimester. That means it have been unmasked during the first trimester, or it has been unnoticed in the first trimester. That means up to 13 weeks of gestation. And usually the GDM by traditional practice is being diagnosed between 24 to 28 weeks, in with a simple test called OGTT, where that means the patient is given glucose of 75 gram and check multiple blood glucose level at fasting. Then the glucose has been given with water, and after 1 hour and after 2 hours. And need to remember that the cutoff, that means for a diagnosis of diabetes, which already Pratibha has told, that there is a difference in the diagnosis of diabetes during pregnancy. That means that 126 or 110 or 120, it's not that different number. It is actually less than that, and it is a very strict number. And and also need to remember that many a times the HbA1c, which we call as a average for blood glucose, might not be an indicator to help in many ways, because this diabetes was diagnosed in the middle of the pregnancy, which actually goes hand with the hormonal surge. Also need to remember that there are a lot of medications available for diabetes already in the market, which we cannot give upfront for all the patients with diabetes during pregnancy, that happen at 24 to 28 weeks. And remember that insulin probably comes in the top of the list, because it does not have a major impact on the uh, developing fetus. And if there is that apprehension towards injection, metformin would be the choice in this patient. This is a pregnant woman getting diabetes. But remember that because the prevalence of diabetes is more and more, there is something called pre-existing diabetes during pregnancy. We are seeing more and more, and we'll be seeing in the subsequent time. That means the women, an unmarried women, has diagnosed about diabetes, getting married and coming for an antenatal checkup. That way, it's called pre-existing diabetes or pre-gestational diabetes prior to their pregnancy. It is getting more and more difficult to treat as well as explain to a patient, because the main problem here is we cannot use certain drugs which can be carried over during pregnancy. So if the patient is on multiple drugs, we end up changing over to an insulin, which could be two times insulin, could be four time insulin, like an insulin deficiency state like type 1. So, and also important is that control of diabetes during pregnancy as well as pre-existing pregnancy. It's very, very strict, as Dr. Usha has told. So we need to have a frequent checkups, frequent monitoring, and even if there is a pre-existing diabetes, and important is complication, because diabetes control is not the one goal. It is actually the complications which happens in the kidneys, could be in the eyes, or could be in the feet. So all this complication needs to be evaluated. So more so if there is a pre-existing diabetes, because the women has diabetes and get pregnant, they are more and more risk for a complication, especially a retinopathy, which is get unnoticed and developed into a florid eye problem, which requires an intervention, or could be an kidney problem, which could be minute, mild, and get unnoticed, which could flare up to an disease where it need to be managed, and it could have a detrimental effect in the developing fetus. So uh, it's simple. The diabetes in pregnancy is an important disease which has to be taken care. And remember that this is just an initial stage. All the women who has GDM during their pregnancy has high risk for developing diabetes, which goes exponentially up to 5% at 50% at 5 years, and even goes up to 100% after 25 years.
राइट, थैंक यू सो मच सर। सो वही मतलब इम्पोर्टेंस है कि प्रेगनेंसी में आपका डायबिटीज़ अगर डायग्नोस होता है तो बहुत ज़रूरी है आपका शुगर अच्छे से कंट्रोल हो, क्योंकि उसका इफ़ेक्ट केवल माँ पे नहीं बट बच्चे पे भी पड़ता है। सो इट इज़ वेरी इंपॉर्टेंट कि प्रेगनेंसी के टाइम पे अपना ब्लड ग्लूकोज का ध्यान रखा जाए, उसको अच्छे से कंट्रोल किया जाए, मोस्टली इंसुलिन से, अगर हो सके तो टैबलेट्स, कुछ टैबलेट्स हैं जो सेफ हैं जो प्रेगनेंसी में दी जाती हैं। तो so the next question, as Sir told Dr. Annie, that even we are seeing more and more women who have diabetes from before, and then they are getting pregnant, and we are actually having a challenge managing them also. So is it that women or men who already have diabetes, does diabetes affect fertility also? So can you tell ma'am that what is the effect of diabetes on fertility?
Yes, Aditi. The diabetes has a direct effect on fertility. Fertility is nothing but your ability to become pregnant and give birth. So there is a misconception. People think if the diabetes of the mother alone is well controlled, the fertility is fine. But it's not true. Even the male diabetes also leads to a lot of infertility issues, like they can have sexual dysfunction, they can have erectile dysfunction, even the sperm quality can be impaired, they can have genetic diseases. All these can be there, which affect the fertility very badly and decreases the chances of conception. So it's important to get a good glycemic control for both the male and the female for proper fertility. In females, if you look at it, they are at a risk of, most of them can have, when it is uncontrolled, they can have irregular cycles, they can have secondary PCOS and anovulation, all these can also cause infertility. Even after conception, like Dr. Felix sir had told, it is important to get their blood glucose levels well in control, because during pregnancy, again, they can have complications, both related to birth as well as both related complications postpartum in the child too, like big babies, increased cesarean sections. You can have even miscarriages if the diabetes was uncontrolled previously. So, fertility is a major issue, and before conception, it is important to get a good glycemic control for both the male and the female.
राइट, थैंक यू सो मच मैम। सो वही जो मैम ने बताया कि केवल औरतों में ही नहीं बट इवन फॉर मेन ये देखा गया है कि अगर आपका डायबिटीज अच्छे से कंट्रोल नहीं है तो बोथ मेन एंड वुमेन दोनों का फर्टिलिटी अफेक्ट हो सकता है। इसीलिए बहुत ज़रूरी है कि अपना रेगुलर चेक करा के अपना डायबिटीज़ अच्छे कंट्रोल में रखें ताकि आपका फर्टिलिटी उससे इफेक्ट ना हो। सो वी हैव डिस्कस सो मच अबाउट डायबिटीज, कैसे कंट्रोल करना है, कैसे डायग्नोज करना है, बट व्हाई आर वी सो वरीड? बिकॉज डायबिटीज आपके बॉडी में सब ऑर्गन्स पे उसका इफेक्ट आता है, जिसको कहते हैं कॉम्प्लिकेशंस, जिसके लिए ही इतना इम्पोर्टेंस होता है कि आपको अपना डायबिटीज कंट्रोल करना है। सो क्या है ये कॉम्प्लिकेशंस और बॉडी के किस किस ऑर्गन को ये अफेक्ट होता है? सो डॉक्टर प्रतिभा, इफ यू कुड टेल दैट what are the complications that patients with diabetes can get, and what all organs does diabetes affect?
Yeah. So just now we discussed that diabetes, yes, it is there, its prevalence is increasing, but definitely the complications of diabetes we can avoid by taking good care of diabetes and good glycemic control, as Usha madam has told. So it is the poor glycemic control, deranged blood glucose level that damages the body. And it is not only the high blood glucose level, but we need to know the wide fluctuations in the blood glucose level. The some people do the fasting, which will cause the low blood glucose level, and then fasting and feasting. So both of them, both the opposite ends are damaging to the diabetic patients. So they should not fast for a longer period. That can cause hypoglycemia, and binge eating, which cause hyperglycemia, and this is called as glycemic variability. So both high and low blood glucose level will damage the various body organs. And the most important, what we see around is the cardiac disease. That people can develop increased blood pressure, acute cardiac event, what we call as acute heart attack or myocardial infarction. They can get chest pain on exertion, or they can get the reduced pumping of the heart. All these are the complications of diabetes, which can occur at diagnosis also, or maybe in 10 to 15 years of diabetes duration. That will increase the cost burden to the patient, that will reduce the productive years of life, and it can cause it may be life threatening sometimes. Like cardiac disease, the another disease that the complication that affect the diabetic person is the kidney disease. There can be reduced kidney function, where they need to go on dialysis, which is expensive and which is painful, and it may cause the kidney failure and may require kidney transplant later on. Apart from this, the another complication of poor control of blood glucose level is the eye complications. They develop reduced vision, the fluctuations in their refraction and the eyeglasses number. It can cause cataract development at an earlier age, or sometimes it causes damage to the retina and bleeding in the eyes, which can cause permanent loss of vision. And I think diabetes is the most common cause of loss of vision and blindness in Indian population. Apart from this, the diabetic patients also develop damage to the nerves all over the body, but mainly it damages the nerves of the lower limb, that is feet, which will cause the recurrent ulcer. It takes longer than normal time to heal the ulcer, and sometimes it can lead to amputation, loss of a limb, and deformity in the patients. Apart from this, the other complications which are very common with the diabetes, poor glycemic control, is the recurrent skin infection and a recurrent dental infection, which gets the patient to the doctor and they get diagnosed because of this kind of infections. I think and all these can be preventable by good glycemic control. So if Aditi permits, I just like to say one line here. So people say that my sugar is 250, 300, but I'm absolutely all right. I do not have any problem today. So why I should control it? It's like an insurance. We pay installment every monthly, every year over 10 years. And at the end of 10 years, we get that benefit of life insurance or LIC. But what we get by putting installment, if by controlling my glucose level, doing my test every monthly even without any symptoms, actually after 10 years I'm going to get my vision, I'm going to get my kidneys, I'm going to get my good heart. I think there is no money value for these things. So at the in the returns in 10 years, we are going to get these things, and these are more than the LIC installment. So we should do this installment for our health over a period of time to avoid the complications. I think that is what we'd like to say for our patients.
Thank you so much, ma'am, for explaining all our viewers कि actually it is like really investment है ये हमारा कि आप अपना डायबिटीज को अच्छा कंट्रोल करके अपने सारे ऑर्गन्स को आप कॉम्प्लिकेशंस होने से बचा सकते हैं.
They are valuable.
आँख, किडनी बिल्कुल बहुत वैल्यूबल्स, हमारे सारे वैल्यूबल्स हैं ये, हमारी आईज, हमारा किडनी, हमारी नर्व्स, हमारा हार्ट. डायबिटीज आपके सारे ऑर्गन्स को इफेक्ट कर सकती है. सो द ओनली वे इज कि अपने डायबिटीज को अच्छे से कंट्रोल करिए और अपने ऑर्गन्स को प्रिवेंट करिए. So, Madam, Dr. Usha, Madam, I would want to ask you that how do we actually screen for these complications? So, patients who have diabetes, like they can do some tests so that they can screen for the complications. If they have, they can pick it early. So, basically, the screening for these complications, ma'am, if you could tell.
I think this is one of the most important questions. See, as we've just said, for your insurance policies, you pay every year. God willing, you may never need to use it, but you don't consider that payment as looting. You consider that payment as an investment. And yet, when patients come to a doctor and you give them tests to do, they think that doctors are writing unnecessary tests or too many tests. Now, the complications have been mentioned: eyes, feet, kidneys, the nerves, heart, brain, all of these. Now, if we don't screen, I mean, more than what do we need to screen? What test do we need to do? The fundamental thing is, if we don't screen, until you have a symptom that's major and potentially damaged that's irreversible, you will not know if you have any complications. Say, for example, your eyes. The first symptom you have may be a bleed in the eye and loss of vision. Whereas if you get your eyes checked regularly, at the stage when it can be prevented, you can still catch it. Similarly, heart. If you do your ECG, if you do your echo, or if you do your treadmill over a certain age, if there is any narrowing, if there is any blockage, we can treat it either medically or otherwise. But it means that you will not endure permanent damage to your heart muscle because of a heart attack or heart failure. So tests are really important because not just right at the beginning, remember we talked about diabetes having no symptoms. Dr. Felix said that in the majority of patients, you may not have any symptoms. The complications also may not have any symptoms. And unless you screen, you will never, ever, ever find out until it's too late. So what do we do? Start at the top. For your eyes, have an yearly at least eye checkup where they actually look at the back of your eye, not just for your glasses, but look at the back of your eye to look at changes of diabetes and check the eye pressures to check for glaucoma. Because glaucoma is also more frequent in people with diabetes and can cause blindness. Look at your heart and lungs, especially at least do an ECG. If you have any symptoms, your doctor may request an echo or a treadmill test. Get your feet examined. It may not require any fancy test, but at least checking the pulses and checking the sensation and maybe the reflexes. And if you can perceive hot and cold temperatures, may be enough as a starting point. But and check your cholesterol, because the best way to prevent heart attacks and strokes is to check your cholesterol and have it treated. Check your blood pressure, because again, the blood pressure, the cholesterol, the diabetes all travel together to cause these complications. So when we talk about screening, think of the test that you're doing for screening as your insurance premiums for your insurance policy. It's your health. The doctor gains nothing by doing these tests. However, pick up something early enough, and this could be life altering, limb and life saving for the person living with diabetes. So, testing is extremely important. The test will cover everything that presents a risk to diabetes that could potentially be a complication.
Right. Thank you so much, ma'am, for explaining it in so much detail. And so, bhai, ki डायबिटीज के पेशेंट्स के लिए केवल शुगर ही नहीं, उनको एटलीस्ट ईयर में एक बार ही कॉम्प्लिकेशंस के लिए, जैसे कि आंख का टेस्ट, किडनी का टेस्ट, हार्ट संबंधित टेस्ट, ब्लड प्रेशर, कोलेस्ट्रॉल, ये सब कराना बहुत ज़रूरी है। बिकॉज यही इसी से पता चल सकता है कि आपके और कोई ऑर्गन पे डायबिटीज़ का इफेक्ट हो रहा है कि नहीं, एंड उसको जल्दी पिक करके उसको जल्दी ट्रीट किया जा सकता है। So I think moving on to the next question, I think Dr. Felix. So we have diabetes at across various age groups. So the more vulnerable age group for us are the elderlies who are frail, and those who above 70 maybe. And so what are the challenges that we face in managing diabetes, and what are the precautions we should take when we are treating diabetes, especially in the elderly vulnerable age groups? So if you could tell.
Yeah, thank you for that question. And we know that our average lifespan is increasing more so in women than the men in across the globe, and more so in Indian subcontinent too. And also because of the advent of new drugs, as well as the other comorbidities being diagnosed early and treat appropriately, the people with diabetes actually live longer than and what we used to be see in the past. And so the diabetes prevalence in at the age more than 65 years, it's actually goes as high as 35% in many studies, even in Indian studies too. So, if we look at the people living with diabetes are more than 65 years, they do have other comorbidities like hypertension. They could be having a past history of an heart attack, could be had a stroke in the past, or maybe having a rheumatological illnesses which has been adequately treated. So, and leaving aside this, the one of the important neurological problem which we see in elderly people is the cognitive impairment, which is actually is very very important to note down in patients with diabetes, because it has a direct proportional to the control as well as the 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 other complication. One of the important is that they tend to forget their medicines, and they tend to have hypoglycemia because they increasingly take more tablets because of their cognitive impairment. So that is why International Diabetes Foundation Federation (IDF) has actually divided the geriatric population, probably in other words, elderly population of more than 65 years, into three categories. One is those who live independent of their functions, where you could have an reasonable control as per their other comorbidities. And secondly, there is a group where there might be a fragile people with normal memory and its other function, that means cognition. And also in the second group they divide one more group where they could be having a fragile with then cognitive impairment, and thirdly an end stage disease, or could be another disease which causing the end stage of their life. So that the glycemic control could vary according to the comorbidities and the category which I mentioned. So but very very important is that the hypoglycemia, which is scientifically called hypoglycemia, is nothing but low sugars, which actually is a very very important factor to be educated to the patient as well as their relatives, because many times the elderly person may not be able to take care of them when they have low sugars, and that has to be treated appropriately. So their relatives also has to be adequately educated. Secondly, important to look at the compliance of their medication. That means whether they take the medication appropriately, in better way to look at having a tablet box or having an app where they are correctly taking. So supervision of the medication is very very important. So by and large I would say only two things: the glycemic control depends upon the where they stand in terms of the comorbidities, that cognition. Secondly, the low sugars, which is going to be a because of their other, could be a kidney problem which can cause high mortality. And important to educate the relatives to understand how important to treat a diabetic low sugar at an appropriate time with appropriate therapy.
राइट, सो थैंक यू सर। सो वही कि मतलब जो एल्डरली पॉपुलेशन है, उन केस में केवल उनको ही नहीं पर उनके फैमिली मेंबर्स को भी हमें थोड़ा सा डायबिटीज के लिए एजुकेशन देना पड़ता है, लो शुगर, शुगर कंट्रोल, उनके टैबलेट्स के बारे में। सो दैट इज द थिंग कि फैमिली एजुकेशन इज इम्पॉर्टेंट व्हेन इट कम्स टू द एल्डरली patients. So I think coming to the next question, Dr. Annie, it's like completely different age groups. So one more challenge that we face are the adolescents. So we are seeing more and more children also who are getting diabetes, not only type 1 but type 2. So we are seeing more and more adolescent diabetes. So what are the challenges that we face in that age group, ma'am, as far as management of diabetes is concerned?
Yeah, Aditi. I think that is the most challenging group for whom diabetic control is very important, more important than an elderly. For them, getting their blood glucose levels because they're at a younger age, preventing complications for them is very important. So, for that group, diabetes control is very important. But the thing is, adolescent group as such, even without diabetes, it is difficult to manage, both in the family as well as in school, everywhere. So adding fire to that when a patient gets diagnosed with diabetes, like you said earlier, if an adolescent came with diabetes, it was mostly type 1, which is very difficult to deal with. Now we are increasingly seeing type 2 diabetic in that group, which is a little bit more easier to manage, though convincing them that the importance of management is very important for them. It's the thing. Good thing is their diabetes will get controlled with pills, and by motivating them well enough for a good physical activity and lifestyle modification, it is easier to get the blood glucose levels in control. But that group, the emotional changes, the physical changes they are undergoing, it is difficult for even the family members to convince the importance of control. So a good support system is very important in that group. And when they are type 1 diabetic, again they are scared of needles, and they don't want their peers to know they are diabetic. They don't want people to see them prick or use an insulin pen. Then they do have peer groups who bring about lots of food in school, which is difficult to control. So that group, I think a good support system is important than just prescribing pills, and it is important to convince the family also, because a lot of they are also in denial when a child gets diagnosed with diabetes. They say, how can my child get diabetes at such a small age? And they themselves are worried, if I give them pill, if I give them insulin, that is going to have a long term damage to the kids. So convincing the family is also an important thing in when an adolescent gets diagnosed with diabetes.
Right, ma'am. Thank you so much for highlighting the challenges in adolescent age groups. So now I think maybe the last question for the day today that, so ma'am, it's for Dr. Pratibha ma'am, that we are seeing more and more diabetes in the 20s. Now our young adults are having diabetes. So is this true that, the prevalence in young is increasing for diabetes? And is there something more concerning when you have diabetes at a younger age group? Is it more aggressive? And what is your opinion, and what is it in young diabetes that you have to say, ma'am?
Yeah, definitely, Aditi. Previously, when we used to consider diabetes, the thought process of our mindset is that the diabetes is a disease of a older age group, maybe after 40, 50 years of age. But recently, we are seeing similar type 2 diabetes occurring at a younger age, just like Dr. Annie said, even adolescents are getting type 2 diabetes. And probably this is because of the rapid urbanization that is happening in the developing countries like India, maybe more socio-economic development, which is making the ample availability of the food, but that is a kind of a carbonated or maybe processed food, more in the trans fat, more of a carbohydrates, which is making them to increase the weight and increase the fat tissue in the body. That increases the insulin resistance and more chance to get diabetes. So again, the increased working hours in a day, but maybe it is a sedentary work that has increased. So it is a lack of sleep because of the media, multiple media available in the hand, the Facebook, Twitter, everything is on the phone. So maybe more number of working hours that reduce the sleep hours, or maybe the media which reduces the stress, reduces the sleep. I think these are the factors which makes the people to get the diabetes at a younger age. Additional factor which is not preventable is the Asian race, who are more prone for getting diabetes. They get diabetes at least 10 years earlier than the Western population. So second question is whether it is more aggressive or we need to concern. It's not aggressive, it's type 2 diabetes, but because it is developing 10 years earlier in the Indian population, the person has to live more number of years with the diabetes. And if you say that more number of years, that more chance that they will develop complications of diabetes, which will increase the disease burden, cost burden, and reduce the productive life. And that is why we are worried, and we need to diagnose them early and treat them very vigorously to avoid these complications. I think that is about the younger diabetes.
Right, right. Thank you so much, ma'am, for explaining that. And I think we're almost towards the end of the session. Yeah, so I think because of short of time, so we'll just quickly ask all our esteemed panelists for their take-home message for all our viewers who are logged in and listening to us. And so I'll start with Dr. Usha, ma'am. Any one take-home message that you want to give to the viewers about the diabetes and how to take care of their health, ma'am?
Thank you, Aditi. It's been a wonderful session. I mean, the range of questions you've covered are amazing. If there is one take home message, the theme for World Diabetes Day this year centers around diabetes education. And I think that's the most important thing. Learn about your diabetes, be aware of it, and engage in your care. It's not just you go to a doctor, they give you a prescription, you take the pills. You see a doctor for maybe 10, 15 minutes every 3 months, but you live with it the rest of the time. So learn, engage, and be an active advocate for yourself. Look after yourself and learn about your diabetes.
Right, ma'am. Thank you so much. And I think, Felix, sir, anything that you would want the viewers to know?
Yes, so be active and know more about yourself, and take care of the mother with diabetes, because they are actually at risk for diabetes of future. So probably the three things I would um, will highlight.
Right, sir. Thank you so much. And I think, Annie, ma'am, anything that you want to highlight?
I would suggest learn about diabetes from the right source. Avoid following all the myths that you hear from all the social media, and start treatment early and get your diabetes well in control to avoid complications.
Right. Thank you so much, ma'am. And I think, Pratibha, ma'am, what about your opinion, ma'am? A take home message for the
I,
viewers?
I do agree with Usha, madam. First thing, learn about your diabetes. And instead of treating diabetes, what we learn in our preventive medicine is prevent developing diabetes. How we can prevent, but start from your child. Like we make our child strictly to take a bath every day, do a brush every day, but we do not strict with your child to do the exercise every day. So from childhood, we should teach our child like you have to do the exercise every single day, like you do study every day. We need to give a good dietary habits to our kids and follow healthy lifestyle and start screening for all the age groups. Like Felix has
Absolutely
mentioned,
summarizing. Come on.
we should screen them, detect them early, detect them at the pre-diabetic stage, give them a good lifestyle modification, and prevent development of diabetes
Oh,
instead of
yes, Naina.
treating it. So every endocrinologist would love to prevent the diabetes and prevent the complications. I think that is all.
Yeah, right. I think thank you so much for all the panelists for their concluding remarks. I'm sure our viewers would have learned a lot about diabetes, how to take care of the diabetes. I think it was a wonderful session listening to all of you. And I think thank you to all the viewers. Thank you to Endocrine Society, and thank you to all the panelists for joining in. Thank you so much.
Thank you all. Thank you, Aditi. And
Thank you
thank
very
you.
much.
Thank
And
you.